Hello, Dr. Shina Horiuchi. Welcome to the show.
Well, nice to meet you, or, thank you for having me today.
No, it's a pleasure to have you on tonight. Some of our listeners might be familiar with your work at Tokyo Medical and Surgical Clinic. For those of the listeners that aren't, perhaps if you could just provide a bit of background on yourself, what you've done sort of academically and professionally up to this date.
Okay, well, I'm a gastroenterologist slash internist. I'm originally from Sapporo. I graduated from a medical university there. And after receiving a doctorate degree, studying mainly on cancer, gastrointestinal cancer, more specifically colon cancer, I moved to San Diego, California, and then studied there. And then I did some, molecular biology research on colon cancer.
Wow.
Yeah.
Okay.
And, working there for 5-6 years, and then moved back to Tokyo and joined TMSC 2016.
Wow,
Yeah.
it's been 4 years already.
Yep. And now I'm working as a gastroenterologist at TMSC.
Very cool. Yeah, I guess first of all, what actually is a gastroenterologist, and what exact sort of conditions does that cover?
Well, gastroenterology covers, gastrointestinal tract is like a long pipe from your mouth to the anus. And then gastroenterology covers them all, from your, mouth is not exactly, but from your throat, esophagus, that's like a pipe, upper pipe, and connecting to the stomach, and duodenum, long, small intestine, and large intestine,
right,
to the anus. So that's my field.
That's your field, that big long tube. and what made you interested in this field, and in particular your special interest in colon cancer? Where did that sort of come from?
Well, patients often ask me why I chose my specialty. And then I remember when I was a med student back in 90s, I was completely fascinated by fibroscopes. And it's like like a game, or, doing some maze kind of thing. It's really fascinating and very visual and very fascinating. So I think that was the first attraction that got into the specialty. And also in Japan, we have a big number of GI cancer patients, especially stomach cancer then. Today, I think I would like to focus on colon cancer, but actually for many, many years in Japan, stomach cancer is a much bigger issue than colon cancer. And then over the last few decades, probably, the trend is completely opposite. Number of stomach cancer has significantly decreased as the number of colon cancer patients significantly increased.
Okay, interesting. Yeah, I guess we can sort of go on to why that might be, or why that's sort of hypothesized to be. But I'm interested also to know about the research that you conducted when you were in San Diego, and what sort of things that you found. Were there any sort of interesting findings out of that time?
Well, I'm ashamed to say I have found something really important. Well, but I was studying on, the change or the pre-change at the very first onset of colon cancer, much, before the actual onset of colon cancer. The change has already started on a DNA level. And then that was my, interest back then.
Yeah, very cool.
Yeah. But I, at some point, well, I felt like, I am not really a cutout for, scientist, because I often tell that, scientists, basic scientists, and then also practitioners are very, very different, even if we
Absolutely.
are working on cancer. Um, both of them are working on cancer. To be successful, to become a successful scientist, you need to be very creative.
Mm.
But to be a successful or established practitioner, it requires a different trait, like
Absolutely.
being a people person, or
Yeah.
communication skill, and then it's something more absurd.
Yeah, I think that's the same in any field, in our field. I mean, I think I always get accused of bringing everything back to orthopedic medicine and physiotherapy, but I think that a lot of physiotherapists are lucky enough to sort of balance both. I think there's quite a few people in our profession that do clinical work and research work, but then there's definitely people that aren't suited to either ends of the spectrum. There's some people that can sort of fall in between and do a bit of both, but there's definitely those sort of research types, and then there's definitely the sort of 100% clinician types.
Yeah,
Interesting.
definitely.
Yeah, so I guess given that you've got some experience working in the West, and then you've obviously done a lot of work in Japan, what do you see are the main sort of differences in, I guess, epidemiology around colon cancer, and then also the way that it's screened for between different countries, and I guess also in management and prevention?
Yeah, very good question. I would like to talk about stomach cancer first.
Sure, let's go.
Well, as I said, we have had a big number of stomach cancer patients, where in the West world, you have much fewer cases. And then back in 1980s, well, brilliant Australian scientists found that, the cause of the stomach cancer, the main cause of the stomach cancer, that's a bacterial infection. And then it's got a Helicobacter pylori. And then it's by far the number one cause for stomach cancer. And then actually 99% of all Japanese stomach cancer patients are positive for this bacteria.
Okay.
That is that closely related.
Yeah, wow.
So well, this bacteria can live only in the human stomach, and then stay there for many, many, many years, and then damaging your DNA there and leading to cancer. And so, back in 80s, they found that out. And back in 90s and 2000s, it became a national project of Japan to eradicate this bacteria, to decrease the number, eradicate the stomach cancer.
Yeah.
And then, luckily, we have been quite successful. And then with that, we've seen, drastic decrease in number of stomach cancer patients.
Yeah. Sorry to interrupt, but do you have any statistics off the top of your head on what that looks like, what the numbers were like before those interventions were implemented? Or
the number of stomach cancer patients?
Yeah.
It's a tough question. I cannot give you the exact number at the right off the bat. But
it was a drastic reduction.
Big difference. Yeah.
And what do you know with that specific bacteria? What percentage of patients who are carrying that bacteria actually went on to have stomach cancer? And was that something that was screened for when they started recognizing that it was a risk factor?
Yeah. So a screening test is quite simple. There are basically 6 ways to get screened. Blood test and like a blood test, stool test, for the test with the fibroscope, but usually we do a screening test with either blood or stool.
Mm.
And then once we know that you're positive, we strongly recommend, we strongly advise eradication therapy. That is a combination cocktail therapy of antibiotics and then antacid medication for 1 week or 2 weeks.
1 week or 2 weeks. Okay.
Yes. Yeah, it's pretty simple, but definitely it's really worthwhile. The statistics says, well, the risk for stomach cancer can be reduced to 1/3 to 1/10 by eradicating the bacteria. So
really?
definitely, it's really important to know. Well, first, it's really important to know if you're infected or not.
Yeah.
And then second, if you are positive, eradication is really important. In terms of difference in the West and Japan, the number of colon cancer, well, like 30, 40 years ago, we did not have many colon cancer patients in Japan. Whereas in the West, including in the US or in Australia, of course, well, colon cancer has been top among the top 3 causes of death for quite a long time. And so as I said, but the number of colon cancer patients have been significantly, remarkably increasing in Japan. And then, the number or the rate is getting closer to the West. And then it's often assumed that probably the reason of this trend is change in diet, westernized diet, and then maybe chemicals in the food, or some possibilities or theories have been told, but maybe they're all combined.
And again, any idea on what sort of increase there has been in the last few decades? Are we talking about sort of double the numbers or 10 times the numbers of colon cancer now? Or?
Well, colon cancer, in terms of the list of the death tolls in Japan, well, colon cancer was way lower than this, like a 5th or 6th, after stomach cancer, lung cancer, breast cancer, but now number 1 or number 2. So now this is the issue we've been working on.
Yeah. And so colon cancer screening then, how has that changed in Japan?
Well, colon cancer screening, the most direct and most effective screening test is fibroscope, colonoscopy.
Yeah.
Of course, the very first step for screening is to get a stool test, FOBT or FOB, or fecal occult blood test. And then if you're positive, meaning that even a small amount of blood is detected in the stool sample, then you need to move on to colonoscopies, because fecal test, stool test can only tell you that there's some bleeding, but you cannot tell what it is. I mean, it can come from hemorrhoids, it can come from just a tear, or it can come from polyps.
And in terms of screening for this, what are the sort of current recommendations, say in the United States, and then what are the recommendations in Japan?
Yeah, well, just a few years ago, there was a big change in terms of screening test or screening recommendation. For many, many, many years, the first screening age for colon cancer has been 50 years old. That's the golden age for screening test.
Yeah.
But um, over the last maybe 10 years or so, we observed some worrisome trend. That is, we see more and more younger colon cancer patients.
Mm.
And then we don't know why, but traditionally, colon cancer is considered a condition for older people,
Yeah.
like people in their late 50s or even 60s or 70s. But we see more and more, younger ones like in their 40s or even in 30s. And then actually, even at TMC, I remember I saw at least a few advanced colon cancer patients, unfortunately, in their early 30s.
Really?
That was really shocking. But still, they were advanced, but still they were curable.
Right.
Yeah, so that was good for them. But the basic rule when it comes to the cancer, the earlier detection is the key. So
Yeah,
that is why we put a big emphasis on a screening test and then preemptive, treatment. Anyway, so we see more younger colon cancer patients. So just a few years ago, American Cancer Society lowered the first screening age from the traditional 50 years old to 45 years old.
Okay.
And, some insurance company, follow suit. Well, that's a good trend. And then, So now we recommend everybody, with or without symptoms, we strongly advise first screening test at 45 years old. Well, if you have a family history of a colon cancer, even earlier than that, to find the early cancer detection.
Yeah. And when you say we, is that just a protocol within your clinic, or is that something nationally that's recommended as part of Ningen Doku, or is that how is that done on a sort of national level?
So Ningen Doku, in Japan, Ningen Doku, regular Ningen Doku covers they perform stool test as a screening test.
Yeah.
But as I said previously, it's just a first screening test, and then it can't be stopped there when it's positive. So if it's positive, definitely it has to move on to colonoscopy.
Yeah.
And then
And how prudent is that in Japan? Like, if someone has a positive stool test on the Ningen Doku, are the rates of follow up on that and patient receiving the proper management and treatment fairly high, or is that something that still needs to be improved on?
Good question. Unfortunately, I really don't have an exact number. How many people really follow, take the right step. But for some reason, generally women are more reluctant to, receive the test.
I can't imagine I haven't had one yet, but I can't imagine.
You haven't? You haven't? Oh, well, maybe it's it's time to take one and then share the experience.
Right. And in terms of treatment strategies, are there sort of differences in management strategies between different countries?
Well, not really. The treatment, when it comes to treatment, it's pretty much standardized. So I don't think there's a big difference when it comes to treatment. And then pathology, judgment is universal too. But maybe you're interested in, maybe we can talk about the procedure itself. There's some certain difference um, in terms of procedure itself. I
Yep.
mean,
And
generally,
don't be afraid to be as graphic as you like.
well, yeah, I try to be civilized. Well, in Japan, overall, those even invasive treatments or procedures, well, doctors expect patients to be, uh, how can I say, ganbatte, you can do it.
Yeah.
And then, you know, most Japanese doctors take like sedatives or painkillers as just a luxury or
Yeah.
frills.
Yeah. Sure. Sure.
And
Sure.
then so at most ningen doku, procedures like a gastroscopy or colonoscopy can regularly be done without sedatives or painkillers.
Right.
That is the most stark contrast with the procedures in the West. Uh,
Sure.
yeah, and then at TMSC, probably 95% or even 99% of our clients are non-Japanese. So, you know, uh, they take it as a norm to get sedatives or um, what is referred to as twilight. Uh, so when I ask them, um, the sedatives are just optional. So would you like to go with it or without it? They are, shocked. Most of them are shocked, even being asked, uh,
Yeah.
because it's just a norm.
Yeah, of course. Yeah. And so obviously, if someone is in Tokyo and they need to get this done, there's definitely that option of being at Tokyo Medical and Surgical. If people are seeing other doctors, there are other clinics for this, maybe in other parts of the country, you just recommend discussing that with the doctor right up front and making
Yeah.
sure that there is that option for
Yes, definitely.
for medication for painkillers and tranquilizers before they go in. Yeah.
Absolutely.
Any other sort of major differences in terms of either assessment or treatment that you're aware of or the listeners should be aware of?
Let's see. Well, there are some. Well, in we, I mean, Japan. Um, well, sorry to be not conceited, but well, probably I would say when it comes to gastroscopy or GI department, especially a fibroscope, we consider ourselves pretty much advanced or top runner, uh, in the field. And then, there are some, resection techniques which is not available outside Japan.
Oh, really?
Yeah, so of course, advanced colon cancer, for example, we need a resection. I mean, surgical resection, the total resection of the resection of the colon itself.
Yeah.
But of course, we don't want unnecessary. The minimal necessary resection. So the smaller the surgery, the better, basically.
Yeah.
So for that, some brilliant doctors have invented some new techniques, resection with fibroscopes, which which enabled to resect a little advanced cancer without a real surgery. So,
Right.
with with the fibroscopic surgeries, we have shorter hospital stays, and then, of course, less invasion to the body.
Less
So
trauma. Yeah.
yes, yes. So that's a good thing. And then, we do not do actual surgeries. I mean, real surgeries here at TMSC. So we refer patients, well, to who need a, surgical treatment to the larger hospitals. But these days, the number for actual surgeries have been, decreased because
Yeah. Yeah.
of, advancement in the techniques.
Well, that's terrific. Yeah. No, that's comforting for patients to know too.
Yes.
Yeah.
Yes.
Are there any other points or I guess sort of main takeaways? You've mentioned the importance of screening. So anyone over 45, any other sort of tips in terms of gut health that people should know about?
Well, thank you for asking that question. Well, these days, particularly, I'm interested in microbiota. Well, I don't know, Sam, if you're familiar with microbiota. It's
Yep.
bacterial flora in the gut,
Mm,
and it's a very hot topic in our field. And then we
sure.
came to know, more and more about microbiota, and then we came to realize that they do way more than we have thought. And then it's not only about gut health. Instead, it's not only related to constipation or diarrhea. Well, it's related to, we came to know that microbiota has a has something to do with the risk of heart issues or some type of allergies, or even the risk for diabetes, stuff like that. It's
Yeah.
really fascinating. So, you know, to keep your microbiota, your bacterial flora healthy is really important
Mm,
for overall health.
yeah. And even mental health as well. You have that sort of
Exactly. Yes. So
gut-brain
that's
connection.
really
Yeah.
fascinating fact too. Some scientists really believe that some type of mental issues like a depression might be related to this microbiota.
Yeah.
Yeah. Yeah. Isn't it fascinating?
It is. It's
Some
amazing. Yeah.
particular bacteria could have some big impact on your psyche.
Yeah, yeah. And so, and what do you see as the important things in terms of maintaining healthy
Yeah. So
microbiota?
probably you're familiar with the probiotics. That is, fermented foods like a yogurt or kimchi or natto, or I don't know if you're a fan of natto, but any fermented food or sauerkraut.
Yep.
And also there are things called prebiotics.
Yep.
They are considered as a feed for probiotics, essentially dietary fibers like fruits or vegetables. They're also important. And also these days, we use the product called biogenics. That is a great supporter for your microbiota. And actually, we started to provide biogenics to every patient for colonoscopy, for aftercare after colonoscopy, because colonoscopy, as you know, we need a preparation that's a big amount of laxative and completely clean out your colon, and
Yep.
essentially it's like a colon cleansing. So it's like a reset of your microbiota. So this is very good timing to plant good seeds and nurture your microbiota. So
Mm,
it's the best timing, especially 2 to 4 weeks after colonoscopy is critical
okay.
to re-educate or nurture your bacterial flora. So we
Mm,
strongly recommend patients to take even more probiotics and prebiotics and this biogenics. And then, yeah, it's really important period.
mm. Yeah, interesting. And do you do any sort of screening or tests to look at the quality of the microbiota in people's stomach?
Well, actually, there are not many tests available in the market. I mean, at a clinic basis.
Mm.
But sometimes we do stool culture
Yeah.
after the test and see if there's any difference in
Yeah.
Before and after colonoscopy. And also, interestingly, even at our local clinic level, we have had several very interesting cases in terms of microbiota. Are you familiar with the C. difficile, Clostridium difficile infection?
Yep. Yep.
That's a one of a very problematic intestinal infections, especially, well, I don't know why, but it's more prominent in the West.
Mm.
And then some cases are really problematic. It's hard to eradicate.
Yeah.
It's chronic and then it's persistent. And, some patients are really desperate, desperate enough to receive some extreme treatment like FMT, fecal transplant. But still, some people have this C. diff, struggling with the C. diff infection. And then we have had several cases of those cases. And after using this, probiotics, prebiotics, and biogenics. Oh, by the way, probiotics and prebiotics combined, they're called symbiotics.
Yep.
And then so this symbiotics and then biogenics, well, we have had very, very good outcome. They're not medication, but definitely they work on the
supplementation.
Yes, yeah. They're not placebo. They really, work effectively, especially for those, who have some chronic infection or some chronic problems, even included IBS.
Yep. Yeah. Fantastic. Well, there's a lot of really useful information in there for people who, may want to get some screening done or even just speak to you regarding some stomach issues. The best way to get in touch is to book an appointment through Tokyo Medical and Surgical.
Yes, please. Yes.
Yeah. Okay.
Get screened.
Yes, get
even
screened.
if you don't have any symptoms at all, get screened.
Get screened. Well, I turn 40 in a number of days, so I'm still a few years off that. But in a few years' time, I'll be there to start getting my screening done. All right. Well, Dr. Horiuchi, thank you very much for your time tonight. Really appreciate taking time out of your busy schedule.
Thank you for having me today.
And look forward to speaking to you again soon.
Okay.
All right, take care. Have a great evening.
You too.